back to AETV Live. The show is still Health Talk, and I still got Dr. Chinonye Obiman, who is from the Public Health Department of the Federal Medical Center at Asaba, Delta State. We are dissecting the topic menstrual cycle. In the previous episode, she has told us what it is and the different phases. Now, you talked about the medical age. Menarche is supposed to be expected from between age 11 to 14, even though it can happen earlier.
Yes.
So, what symptoms should that young girl spot, and she would know that, okay, my period is coming, I'm about to menstruate? What are the symptoms? Not just the young girl, but people in the reproductive age already.
Okay. This is what you are meant to be talked about. Like, they're supposed to tell them beforehand, like I said. So the symptoms are also included in the things they are supposed to know. It also differs. Maybe what I experience might not be the same as what the other person experienced. Some experience bloating, nauseous,
What's that? Okay.
vomiting, abdominal pain, severe weakness. Some even experience like lack of appetite. Like me, for example, when I'm on my period, I hardly eat. Yeah, I hardly eat, and
Is it why you just lose appetite, or you've experienced pain that causes?
I'll just lose appetite. They will be forcing me to eat. Why some persons will be like they eat, but they vomit. Me, I don't experience that. So it depends on individuals. So you have to tell them all these things so that when they start experiencing it, they will know that it's normal. Yeah.
So, but I don't know what to say, because sometimes these symptoms I get now, they are looking like, should I call it a medical condition?
No,
Well, it's not, especially like
it's not.
my younger sister. I remember back then, my younger sister
Mm-hmm.
used to have severe pains as well. Some ladies call it cramps.
Yeah.
I've seen ladies that, because I've worked with different ladies, that when they're on their period, they can't even show up for an appointment. They just do a message like, Uncle Tom is in town and I can't do that. So, is this a natural occurrence, or there is a reason why some of these ladies feel severe pain?
It's a natural occurrence. It is. Though, some persons who say there are some things you do to reduce the pain and all that. Some even take NSAIDs. But what we are all saying is that, like, okay, non-steroidal drugs, like pain relief drugs, to be less plain. But what we are saying is that all these symptoms, they are natural.
So, but it's okay to take, if the pain is severe, it's okay to take a pain reliever.
One thing with these pain relievers is that you might get addicted to it. Any small pain, you now take it. Like I said, it's a natural phenomenon. So
the pain can be endured. Is that what you're saying?
For some girls, they'll tell you they can't endure the pain. People's bodies are different, and you can't tell how person handles. Some people have a very low threshold. Some people have high. Some persons will be like, no. Whenever they don't even want to experience the pain at all. Whenever it starts, they'll just go and look for their drug and take. Why some will be like, no, I don't want to take drug. It will stop by itself, and gradually it stops. So nobody knows how it happens. So it's your body. So you have to know how you handle it. If you can't handle the pain, you take the drug. I don't advise the drug because it makes us any small pain. You see us running because you already have a solution, running to take our drugs. If you can handle the pain, but if you can't, my dear.
Would you say there are some things that should be avoided? Because I've heard some persons say when you're on your period or when you're getting to not consume lots of sugary substance, that it has an effect. Is there any significant effect those things have?
From my experience, some said yes. I've interacted with most girls. Even I, for example, I noticed that, but still, let me use my experience. That will not prevent me from eating whatever I want to eat.
Yeah, I don't know that. So,
So
but are there no conditions that should? Okay, it's just in relation to your menstruation and all of that.
yeah, so that's what I'm saying. What I'm saying, all these things are, it all depends on your body.
So
If
you
you
can
feel
take a sugary substance and the pain you choose not still very severe. It's the
if,
pain you can endure.
if you take this, if you notice that if you take this like something that is sugary and the pain is severe, don't take it, because if you take it, the pain worsens. So why will you take it? While there are some persons, it does not affect them. That's why I said it varies from individuals. The symptoms you're having is not the same with the other person's symptoms. And what relieves my pain might not be the same with what relieves your pain. Some persons will even say, when like if the pain starts, they used to drink warm water. Some will be like, that warm water no dey work for me. Like it doesn't work for them. Some be like, it works for me. That just you be here, like I've interacted with so many girls, so many females, like I heard so many things. Some people even tell you the position. If you go to internet, you hear some certain things in order to reduce. You can try them so far as it's not harmful, and know if your body accepts them. Then if it accepts them, you know how to reduce your own pain. But if it doesn't, you try another way. It all depends on what works for you. This is just normal. So you have to know what works for you and use that.
So, but in a situation where this is happening, maybe it's severe pain and abdominal pain, it's also okay for someone to go see their doctor.
Very okay. Very okay. Some persons during their period, they say that they can't even like. My friend was telling me about the sister. Whenever the sister is on her period, that she can't walk. That she can't walk. That sometimes she sleeps in the hospital. To tell you that this is just
And all these symptoms, just for clarity, all these symptoms are for normal menstruation. There's nothing abnormal about this.
when it is abnormal. Is will come to abnormal menstruation.
So
At
now
least we know.
let's come to it. So abnormal menstruation. So there is normal menstruation and there is abnormal menstruation. So what makes menstruation abnormal?
Okay, there are many types of abnormal menstruation. So there is one we know as polymenorrhea. It is when the cycle length is less than 21 days.
Okay.
You know, like I said, the cycle length is between 21 to 35. So when your cycle length is less than 21, irrespective of the symptoms you are having, you know that is a problem. So there's also what we call, these are terms we used to classify it, but I'm explaining it. We also what we call oligomenorrhea. This is when your flow is less than 2. You just saw your menses today, and by tomorrow it has ended.
Wait, your flow is less than 2 days. Okay.
Yeah, because the normal is supposed to be 2 to 7 days.
Okay.
So if you notice that kind, you know it is. There is a question mark. You have to go and see your doctor.
Less than 2 days.
Less than 2 days. There's another one. Have menorrhagia. These are like is severe menstrual flow, like the bleeding is much. No, there's some bleeding. If you are bleeding, because it's not your first time, but this month you notice that you have changed your pad more than usual, and it continues. You have to take note of that. So all this heavy bleeding, less bleeding, more than your cycle length, you have to take note of that. So that's what we classify it as abnormal menstruation.
So you just give us 3: polymenorrhea, when the cycle is less than 21 days,
Yeah,
oligomenorrhea, less than 2
2 days, and
and menorrhagia,
menorrhagia.
excessive.
We also have polyargia, yeah, because there are many terms. I'm trying to remember all. We also have polyargia. That is also when the flow is also heavy and it might even pass your normal days, that's your 7 days.
Okay.
So all these terminologies sometimes is really confusing. Menorrhagia, polyargia, oligomenorrhea, polymenorrhea. So you just have to be sure. But what in all things, just know that if your menses is heavy more than usual, you notice you're changing your pad daily, feel like frequently, please look closely. Or scanty blood like oligomenorrhea, just a day your menses stopped, or even if it continued but the blood are scanty, there's a problem.
Okay. So as the day go by, as the
Yeah.
days go by, is the bleeding supposed to increase?
No. It varies. Like let me use I for example. My first and second days are mostly heavy.
Okay.
Or my sister, first and second day is not heavy, but the fourth day.
Oh.
The fourth day is heavy. So this menstruation is physiological. It varies from individual to individual. So you won't just hear from a girl's story and be like, this is how the normal this thing used to be. You're supposed to interact with other people, and then what you just have to know the normal. When it now drifts away from the normal, you now know this is abnormal.
Okay.
Yeah.
So let's talk about the causes of this abnormal menstruation. What could be the causes? Are they medical causes? Are they lifestyle causes?
So let's start from the processes. Let me explain the processes of the causes. They belong to the abnormal menstruation. Yeah. So let's know the normal first before we shift to the abnormal. First, let's know the parts of the system that are involved with the reproductive system, the parts of the organs. We have the brain, we have the ovaries, and we have the uterus. In the brain, we have what we call the hypothalamus. So this hypothalamus sends signals to the pituitary gland. It's in the pituitary gland, that's where the FSH and LH, that's the follicular stimulating hormone and luteal hormone, is produced. So these hormones are triggered, they now spread to other organs like the adrenal glands, the thyroid glands. In the ovaries, they normally say that the ovaries are the hormone making, like that's where most hormones are produced.
Oh, wow.
Yeah. Then we now go to the uterus, where the menstruation occurs if there is no fertilization. The lining of that uterus, that's the endometrium, starts shedding. So when there is an alteration in these pathways, there is a problem. Let's start from the hypothalamus. What cause? There might be alteration, maybe anxiety, even nutritional imbalance. It will affect your menses. Stress, it will affect it because it is in the brain. Everything occurs. It will affect it. Then we'll go to the ovaries. We have the ovarian tumor. We have the polycystic ovarian cyst. Then if you have any of these conditions, it affects your menses. Then let's go to the uterus. Have fibroid. Is also one of the causes. You can have abnormal bleeding. You can also have endometriosis in the uterus. Is also one of the causes. So when you have any of these in your organs, any of these things I've mentioned, it can affect your menstruation.
All right, it's still Health Talk here on AETV Live Conversation. It's still on the menstrual cycle. The focus, though, in this episode had to do with the symptoms and abnormal menstruation. Now, in the next episode, we'll find out if There is a treatment to abnormal menstruation, and we find out how the risk of abnormal menstruation can be reduced, and very importantly, menstrual hygiene.